The topic today is the PRP in my daily practice. In a moment, we know a lot more about all the ingredients of the PRP, all the tools we can use for different indications. It's not only in the plastic and aesthetic surgery PRP is used, it's more used in more or less all faculties in medicine. So orthopedics, the dermatologists, everybody is using the PRP because it has a renewing potential and the regenerative process is improved in all fields and in all tissue types. We have more than 8,000 different publications, and in the beginning we have thought there are only 7 ingredients inside. We have more than 1,000 ingredients who are involved in this regenerative process. You can really say that the PRP treatment in 2020 has really awakened from his deep sleep. I'm now personally involved in the plastic and surgery and aesthetic facial surgery for more than 40 years. And I think there is not really a barrier to the conceptual PRP therapy. We are talking today about PRP treatment concepts, about highly differentiated PRP and its device-assisted drug delivery options. And the basic of all is really the regeneration and the renewing of diverse tissue types. The main ingredients of the PRP, in the beginning, like I mentioned before, are 1,500 regulatory growth factors and proteins. The main potential growth factors are the platelet-derived growth factor, who has a mitogenic activity in fibroblasts, muscle cells, and endothelial cells. And you see how wide this field of the different tissues are. Or the wound healing, the TGF-beta 1 and 2, and of course 3. The wound healing is improved a lot because of the PRP, if I can put in or bring in this local place. Then the vascular endothelial growth factors for the angiogenesis. Then the epidermal growth factors for all the endothelial cells. You see how differentiated all these points are. And the hepatocytes growth factors and the fibroblast growth factors, they are doing really the regeneration and a reorganization of the matrix. And especially for the hairs, we have the fibroblast growth factor 9, who is guilty for this renewal in the hair follicles. This Miss World, I have made on her a facelift 15 years ago. She is coming again in my clinic and she likes to improve her face. Now starts a fight between, I call it the N and K fight. The fight between needle and knife. You should cut or you should do all this not invasive procedures. One of the first places of all these procedures are the PRP treatment. You can really renew the surface. Like Per has mentioned before, not only the facelift is doing a nice looking and a natural looking and a young looking face. The skin is one of the most important points and is a 60% of the feeling of beauty and not beauty. Therefore, we have always to think even on these procedures. What can the PRP do? It can repair of the dermis. This we know. But it's much more important to see the next part with no destruction. To repair the dermis with scar-free healing. This is important, the scar-free healing, because of the TGF-beta-3. The stimulation of collagen synthesis with no fibrosis. If you do other procedures like laser or like a chemical peel, we have a fibrosis. And with this system, we can reduce the fibrosis or we have no fibrosis. We stimulate the body-own growth factors. Which treatment measures can we use with PRP? We can introduce the PRP in the subcutaneous area. In the intracutaneous area, we can applicate it with needling in various steps, depending on the indication, to reduce all the small wrinkles. What I mentioned before is a regenerative process and renewal process. And all these different tissues are renewed. PRP application with needling, and in addition, to make a better bring in from this PRP, you can use the electrointerferosis therapy, especially in a hair renewing, even in the skin renewing. You prepare the skin with needling, you distribute the PRP, and with electrointerferosis, you can bring in this PRP in deeper areas, in a much higher concentration. The PRP application with electrointerferosis, like I mentioned, in the hairy skin. Even in the hairy skin, you don't need to inject, no pain. You can, with the electrointerferosis, you can bring in the PRP on the hair follicle to make a renewing of this hair follicle from this small hair to a normal hair. And we can use PRP application with lipofilling to help the survival process for the lipofilling. In the beginning, when we start about 40 years with this lipofilling in the face, in the hands, on the body, even in the breast, whatever, we have had really problems to enhance, to improve this survival process. But now with PRP, we have a good chance to improve this survival sequence. All these alternative methods we have the ablative and the non-ablative laser treatment. We have needling, we have radio frequency, we have ultrasound. These are in itself self-standing procedures, which are fine. But the PRP, in addition, gives a much better result. Like I mentioned before, with no scarring, especially in ablative laser treatment, or with needling to bring in all these ingredients of the PRP. This is a normal procedure. Superficial intracutaneous injection with a 33 needle or with a 27 needle. Depends on the thickness of the skin. The ideal PRP concentration is, like we have seen, 2.5 times concentration of the platelets. And then we are thinking, okay, it's fine. If we use 2.5 times concentration, then perhaps it's better if we have a higher concentration. But it's not the way. Higher concentration and lower concentration weaken the proliferation of the fibroblasts and the stem cells. Between 2 and 3, this is a good range, but the best results you can have if you double 0.5 times the concentration of the platelets. And if you have a lower concentration, you have to change the procedure to become a much better concentration of the platelets. If you like to heal an open wound, it's not only the PRP, the normal PRP. You have to add some leukocytes inside to improve the debridement of this open wound. This you can have quite easily because on the line of the erythrocytes close are the concentration of the leukocytes. But if you inject in a deep area, you have to see that there are no or only low concentration of leukocytes and no erythrocytes. If you have some erythrocytes inside, it's much worse for the healing process. PRP and needling process, like PRP has a wonderful shown us, it's a quite effective procedure. It introduces the post-traumatic wound healing cascade. It improves the average of stimulation of the TGF-beta-3. And this TGF-beta-3 is guilty for this wound healing with no wounds, with no fibrosis, a scar-free healing. The formation of a new elastin collagen structure is quite important. It makes from the collagen 3, 6, and 9, the collagen 1. It's the youngest collagen. This is quite important for the elasticity of the skin. The thickness of the epidermis, it's double as thick as a normal old skin, because all the points who are inside, hairy, all fatty structures, matrices, and so on, are doubled, more or less, inside of the skin, and the skin is much more healthy. And you have no pigmentary abnormality. The melanocytes are become more equal in the face, and the growth factor production and the skin regeneration is improved. Here you see the PRP and the needling. On the first point, you jetzt muss ich, yeah, you bring the PRP in a normal, simple way on the skin, and on the other side, you can needle on this PRP inside of the skin with different depths from 1.3 to about 2 millimeters. I think in the face, the best depth is about 1 millimeter. Here you see the PRP needling in the case of acne. This is about half a year later. All these processes, if they are done, is not done and fine. It's done and it becomes fine. This is the point you have to explain your patients. Sometimes the result needs about a half a year, sometimes 9 months, sometimes 1 year. You see here in a very hard treating indication, vitiligo. This patient I saw and I said, okay, come on. I try now to help you in a way of needling and PRP. She comes primarily for liposuction, and this was more or less a free treatment. You see on the second picture, you see the treatment or the coloring after about 6 weeks. It's a little bit more colored, but I was thinking, the result is not so fine. Yeah, but when I saw her again 1 year later, it was more or less fine, and you can't see these vitiligo in a right way or in a normal way anymore. To improve this procedure, I mentioned before the electroendophorese therapy. You can do it in all areas where you have needles, and the introducing of the PRP is much deeper and it's a much higher concentration than without this electrophoresis. It's about 0.5 microampere per centimeter what you have to use. These special areas, especially under the eyes, with this quite thin skin, is normally hard to treat. In the former years, we have done in a surgical way, or we have done in a chemical peeling. The results was like so. Yeah? But with this regenerative capacity of the PRP, we can do the primary treatment with the PRP. And we enhance the thickness of the skin, we reduce the wrinkles, but it must be a very superficial injection, not a deep injection. You don't like to improve the thickness of the fat structure. You like to improve the thickness of the skin. Therefore, you have to be quite superficially. I will show you in this picture, you bubble more or less. Oop. And this is the right way. You need about 1 cc per eyelid. And on the other side, you can go after needling and bring in of PRP. You can again inject the fine lines with PRP to reduce and to regenerate all these small wrinkles. PRP healing and engraftment. The publication shows us that after a surgery, after a facelift, you put this PRP in, you have less hematomas, you have less edemas, and the fixation of the bleb is much higher. These are basic information, but they are so important for a surgeon. So we have no barrier in using PRP. PRP and fat grafting. We have said that 2.5 is the best relation of the platelet amount. The addition from platelet-rich plasma and fat shows in all the researches, or more or less in all the researches, that the improvement and the longevity is double. Only in some small publications, we saw some small differences. You can't compare all these publications because the amount of PRP is quite different and the way how they insert the PRP is completely different. And therefore it's hard. But the main publications say exactly that a significant improvement of the survival rate of the fat. Again, even in these publications. PRP seems to improve fat engraftment. We can preconditionizing the recipient area with pre-injecting of the PRP. We can do a mixture with the fat graft, and we can inject after the lipofilling. All is possible. We have seen some equal results in all these procedures. We don't know really the best application, but in the end, it's equal. It should be work. a quite important structure inside of this field, what becomes more active and more strong, is this stromal vascular fraction. In this stromal vascular fraction, you have more than 100 adipocytes. You have all this matrix and the adipocyte stem cells. You have the pericytes. You have all this basic bioactive structures called like a biofiller. It renews in a strong way all these structures, even in the hair. And if it's mentioned before, in the hair, it's quite important to see that you have no injection inside of a vessel. Then you can have a thrombosis and, in the worst case, a blindness. The preparation of the ultra-pure MicroFat is, with this system from Artrex, a chance to have really pure MicroFat. Because of this double syringe, we have a single-use material, we have closed syringe, even with harvesting and processing in the same syringe. This is all the material you have to use in this procedure. It's not a lot, but it's safe. Sometimes it's good to change from the big syringe to a smaller one to have less power on this fat structure. How to harvest fat? It's quite easily. What we have heard before is there are some different places. For me, it's the best place to harvest the fat in this area where the patient said, if I make a diet in this area, I have no chance to reduce the fat. This should be the strongest area. But normally, it's the inner side of the knees and the hip. No. Sorry. So, okay, you can harvest the fat quite easily with a syringe from Artrex and a needle size from 2 millimeter. After this, you can separate the blood in a general way, and then you put it in a centrifugation with about 2,500 rotation per minute, and then you can separate in a really strong way. In the lower picture, you see in which way I introduce it. My personal preference is a syringe or as a calibrated gun, depending on the indication. In this way, I use a calibrated gun. It has the advantage that I can oversize the area. I have a very clear feeling to fill all the fat structures in. This is always a personal way how to do it. Quite deep, in low portions. And on the first picture, you see the difference between one side. I have augmented the malar area and the nasolabial fold and the infraorbital area. And on the second one, you see now the film. I introduce the fat, especially in the tear trough deformity, quite small portions. And you see after the treatment a little irregularities. These are quite simple to reduce because you make a strong finger pressure and you distribute all the fat in this area. With this pressure, you make more or less from the macro and microfat. And then you have no irregularities anymore. So in the hairy area, in this case, I have injected. It's the best way to inject if there is only less hairs. We are talking about 200 per centimeter. This is a normal way. If it's less hairs, you have 100, and then you can improve all this appearance from about 20% and 30%. What makes the PRP? The PRP brings the anagen, the telogen, quite faster in the anagen phase of the hair growing. This is one point. And it lengthened the anagen phase. And it reactivates the small follicles from the small hairs. Therefore, if there is a strong baldness a long time, years, then the follicles are more or less destroyed. You have less result. But if it's a beginning of the baldness, you can start immediately with a PRP procedure, and then you have a regrowing of more or less all these follicles. I have written in my new book with Springer, minimal invasive, not operative methods in the aesthetic of the face. And in this book, I have explained all this procedure for the hair growing without injecting the PRP, only with the electroendophorese. And I think this will be a new way how to do it without pain, without any discomfort for the patient. The failure, we have talked about this too, with the PRP treatment. First of all, you have to have a blood examination to see is a vitamin D in the right level. Because if you have vitamin D deficiency, you have less activities with a PRP and a bad and a worse result. If you have a thrombocytopenia, you have to see it. Then the PRP result are not so good. You have if you have an autoimmune illness, you have to look for this. And if you have a hypothyroidism, first you have to see that it's healed by another doctor. And then smoking. You must think about one cigarette reduce the blood supply for a half an hour. One cigarette. 10 cigarettes for 5 hours. You can do a regenerative process, and if you have 5 hours less blood supply, you never will have a very fine result. Therefore, these points are quite important. The clinical effects from the PRP. You have a better texture, better luminescence, hydration, thickness, and the elasticity of the skin. This is a healthy skin. That the healthy skin looks fine in the present, more or less. But the most important point is that the skin is healthy. You reduce the fine lines, the growth feet, the nasolabial folds, and the circumorbital rings. You have an improvement in the hair appearance. And you have improvement in the orthopedic tendons, muscles, insertions, and the joints. Thank you